So when that injury does occur, what are the kind of symptoms that we see presenting into our office or into a physical therapy chiropractic office? Well, we're going to see pain and quite potentially swelling that's going to exist near the back aspect of that shoulder. A lot of the pain will kind of live right in there, kind of at that corner. Sometimes it radiates its way back up into the neck or radiates down into the chest or travels even further down the arm to about the elbow, but in general, the epicenter is going to be somewhere in this general vicinity at the shoulder. Lost activities are going to include things such as an inability to do overhead activities, such as reaching to the top shelf to grab something out of the kitchen, or think of the baseball player that goes to wind up for a pitch and gets pain when they cock back and go to follow forward. And I know it's February here, so we're in ball season. So think about the basketball player trying to do a free throw shot or a jumper shot. That's going to be painful in that shoulder. Non athlete wise, think of activities such as trying to brush out and comb your hair. That overhead activity is going to elicit pain and discomfort. Let's also think about maybe recent mothers or those with children that have to lift up and pick up their kids or hold on to their kids while they bottle feed and breastfeed. That's going to kind of have that lift and weight on the shoulder and keep that shoulder in an intense load. And just lifters in general, those that go in hip presses and bench presses, incline presses, military presses. Sometimes that repetitive movement overhead is going to cause a flare irritation in there. And a final kind of tip off that it might be a rotator cuff syndrome as well is when we're having issues with reaching behind. So whether that's reaching behind to put on a bra or reaching into the back seat to grab something back behind you while you're driving. So that's a pretty comprehensive list of some of the symptoms that present.